Hi, good afternoon. My name is Dr. Carlotta Gabriele, and I am a nurse leader, a nurse professor, and I just consider myself a nursing leader all around. And today, topic is going to be on human-centered leadership. And what is human-centered leadership? It has been lots of discussions about leadership. There is conversations about what leadership should look like. How do we ensure to be effective in what is it we have to communicate and to help share a vision that will drive us to success? And lots of people have different ways how they want to accomplish that. But one of the things that has been proven to be an effective strategy is the concept of human-centered leadership, putting people first. So I want to talk a little bit about that. While I worked as a nursing director at one of the largest female correctional facility here in Atlanta, Georgia, I was given the opportunity to help strategize and make lots of changes for policies so that the correction facility would be in a space where we can care for the offenders. And I had a meeting with the warden at that time, and he said this to me. I've never heard it before. He said, Carlotta, you remind me of this saying: if service is beneath you, then leadership is beyond you. And I never heard that before. And I was taken aback. I felt honored. Um, it was grateful. I felt grateful to be seen in that light. And really and truly, what he was saying is that lots of time as leaders, we have to start by serving. And in order to lead, you have to serve. So when he said that to me, I said, I have to preface this story to give my presentation. There is another saying by Robert K. Greenleaf. He said, good leaders must first become good servants. Yeah, what does that look like? We have to serve in order to lead. Leadership by itself, it's not just commanding and telling people what to do, but it's showing them, going on the journey with them and taking them along. I wanted to put some stats here because the human-centered leadership didn't become a great phenomenon until post-COVID. And even though we were in a space of, I would say, chronic occupational phenomenon, which means we were losing lots of nurses, the healthcare field wasn't as it should be. And this was before the COVID pandemic. So in May 2019, the World Health Organization officially recognized burnout as a chronic medical condition. Yes, it is a chronic medical condition, naming it an occupational phenomenon. To reflect that, it is a work-based syndrome caused by stress. Lots of us Lots of us can relate to this. We understand this occupational phenomenon where we are stressed out because of our work environment or because of the work that we have to do. Some of the stats that I found as I did my research, it ranged from burnout. 87% of people feel burnout in their occupation. 84 are frustrated with administrators. 84 feel like they are underpaid. 83% feel their mental health has suffered. 77% feel unsupported at work. 61% feel unappreciated. 60% have felt uncomfortable having to work outside of their comfort zone in the past year. 58% of nurses have felt frustrated with their patients, and 58% of nurses have felt unsafe at work in the past year. So just imagine the stats, and this was before COVID, where we were suffering from an occupational phenomenon, chronic burnt out because of stress, work-related stress. How are we going to get this process changed so that we don't feel the effects of the chronic burnout? Hopefully, as I continue to discuss this and the human-centered leadership, the goal of the human-centered leadership is to help with that. The global nursing shortage statistics, again, globally, 13 million nurses. They have met the world healthcare needs where they are having lots of issues just because of the work environment. And the nurses make up 50% of the global population and workforce. 20% of national nursing associations worldwide report an increased rate of nursing shortages. Around 17.5 of the newly licensed nurses quit within the first year. Why is that? Me being a nursing professor, I had the privilege to teach at Georgia State University, where I did clinicals for Georgia State for a number of years. And I remember talking with a lot of the nursing students, and yes, a lot of them became very hesitant because of what they've seen that is happening in the nursing field and other fields, but I'm speaking of nursing. And I remember having to really and truly have conversations with them to help them understand that they can be the change they want to see. It's not going to be easy, but we have to start with one nurse at a time. And one of the things that I always did best was I advocated for my nursing students whenever they were in the hospitals to do their clinicals, because I find that that experience shaped what kind of nurse they become. I remember for me, that is what shaped the kind of nurse I became eventually. Approximately 35.5% of nurses end up quitting within the second year of their jobs. That is sad. That is sad. Why is this happening? So I'll talk more about that. Leadership. What does leadership look like? You know, there is lots of definition as to what leaders and leadership looks like. Some people feel leadership is leading with an iron fist. Some people feel that leadership it's all about compromise. Some people feel that leadership it's being dictatorship. Some people feel leadership it's being laissez-faire, hand off. You just let people do whatever. But I want to talk about the new concept of leadership and what does that look like? The human-centered leadership. The human-centered leaders prioritize their people and their culture. Yet it's not about the people pleasing or just about feelings. It's their intentionality to ensuring that people come first, and not just by words, but by deeds. And if you look at my diagram here, you notice that people, it's the major focus, priorities is next, and process. So it's the three P's: people, priorities, and process. You know, in my opinion, for a human-centered leader, I was looking at what is considered a human-centered leader. I consider myself a human-centered leader because I am all about my people. I am always trying to ensure that my people are doing well, because the better they do, the greater job they will perform. Studies have shown that the patient satisfaction scores go up tremendously when nurses are happy. So it's actually research that as you are feeling better, you do better. There are some human-centered leaders characteristics that stands out for me. You know, one of the things is caring. You know, they're interested in you. They inspire you. They're vulnerable. They seek feedback. They're trusting. They're calm. They're learners. They walk the walk. Yeah, they're thankful. I remember working with an organization and they literally had to make saying thank you as part of the hospital-wide initiative because it was something that never happened. And they literally make sure that that verbiage became part of the hospital's mission, saying thank you. And it improved not just engagement, it improved patient satisfaction, decreased retention, and it did so many great things for the organization. So I would say that if you are thinking of what kind of leader you want to be, try being a human-centered leader. It includes compassion, the ability to be sensitive to people and what they're facing. There's lots of empathy. You take action, you support, and you develop them. Because I do believe that people, you get the best of people when they realize that you care about them. You show that you care by asking them, how are you doing? And a lot of times, even though it's important that they have a task to do, or it's about the vision of the company, it's also important that you make sure that your person is feeling the way they're supposed to. And it's your responsibility as a leader to do that. It's about a genuine intention to contribute to the well-being of others and see them thrive. This can sometimes require honest feedback. Human-centered leaders seek feedback. They don't get upset and take it personal when there's a feedback given, because the goal is for them to understand what the needs are. How can I be impactful? What do I need to do in order for my institution to be successful? And sometimes it just means going that extra mile. Human-centered leaders requires a balance. There's lots of different leadership, as I said before. There's the leader, the transformational, the democratic, those old, what should I say, the old description of leaders in the past, the Democrat, the ones that are, all they rule by the thumb fist, the lazy affairs that sit and do nothing. But the human-centered leader requires a balance. They require a balance of three different phenomenon. An awakener. An awakener is someone who motivates, mentor, coach, and advocate. A connector. Connector is one who brings people together. They bring people together based on the mission, the vision, and the values of the organization. The authentic communication to demonstrate trust and respect for them. They're the collaborator. They're the one who bring everything together. They're the engineer. And then there's the upholder. And if we think in our mind, an upholder is someone who holds something together. And this is what part of the human-centered leadership is. Someone who can hold things together by being mindful, by being emotionally aware, socially and organizedly aware. They must be people-oriented. So those three phenomenons are very important in a human-centered leader: the awakener, the connector, and the upholder. Lots of times you will only find one or the other. In the olden leaders, you wouldn't find all of them. And as a matter of fact, sometimes it wasn't either awakener, connector, or upholder, just someone who rules with an iron fist. I want to talk more about the awakener, the connector, and the upholder. In addition to those phenomenons, I believe that there is some other categories of intelligence that is needed as well for a human-centered leader. There's a transformational intelligence. relational intelligence, and emotional intelligence. And I will break each of those down for you. A transformational leader or transformational intelligence is about high level of care, the self-leadership, coping, and adaptation. It provides the underpinnings for grit, hardiness, resilience, and growth. Increasingly, teams and organizations are focused on performance and results rather than credentials. Yeah. And especially in the time that we are in now, post-COVID, transformational leadership and transformational intelligence is one of the dominant leadership aspects that is needed and actually has proven to be very effective because it's the ability to be able to transform your thoughts, your action, and and help with your outcomes to meet what is going. We are in a changing world. Healthcare is changing every day. COVID has redefined what healthcare looks like. And being a transformational leader or having transformational intelligence, that would help you to be able to adapt and cope with what is going on. We have to be leaders that are flexible, that goes with the trend, that make sure that we can look and see what is working and what isn't. Apply what is, remove what isn't. We can't continue to stay in a space where we hold on to the old, afraid of change, and we are not working to change and be adaptive in the society as the society is changing. Transformational leader, they are purpose-driven. They are great role models. They walk the walk. They're inspiring. They inspire followers. They're people-driven. They're genuinely concerned about their followers. They're innovative. They're creative. That is what is needed in order for us to have a shift in organizations, in systems today. Relational intelligence. I love this one because I am about that. I am big on relationships, and I feel as though if you can have great relationships, you can have great success. In my own words, relationships are the key to success. Well, right relationships, because not all relationships are right for us. So understanding what relationships are right and what isn't, the ability to be self-aware, to know what is working and what isn't, and to be adaptive and flexible and be able to adjust accordingly. Well, relational intelligence, it's an important part of a human-centered leader. Great leaders build great relationships. I believe that in order um, to be a great leader, you have to be able to build great relationships. What is relational intelligence? Relational intelligence is the ability to successfully connect with people and build strong, long-lasting relationships. It is an essential set of skills that today's leaders need in their toolkits. It serves as the foundation for creating cultures of excellence that are relationship-oriented and foster great employee engagement. That is correct. When you look at the hospitals or the medical facilities or any organization that is doing well with success and they have the retention is low, their engagement is great, the visibility and all of the things that is necessary for success in an organization. They have great relationships. They build strong relationships. I always remember my mentor saying to me that people work well with you when they like you. And one of the first books, as I started my leadership journey, one of the first books that someone gave to me was How to Win Friends and Influence People. And I was taken aback because I thought I was the social butterfly of everything. And then I realized that no, it's not just about being social. Is how do you connect and build? And that takes a special kind of craft. So when I read that book literally lists how do you build relationships? So I will recommend that book highly. It's a great book. It helps with that. So anyone who is thinking of going down the leadership path, that is a great book for beginners in building your leadership portfolio. Emotional intelligence. Emotional intelligence. What is that? Just the thought of being intelligent emotionally speaks volume. And I remember when I first heard about emotional intelligence, I thought, okay, this is something new. What is this about? Until I read the book. I think that was one of my best reads. Emotional intelligence is the ability to be self-aware on what is and what isn't. And that is just my little definition of it, but I will get into more details. Daniel Goldman said, a leader's primary task is emotional leadership, requiring them to consistently be optimistic, be authentic, and have high energy. To be aware of how their moods drive the organizational moods and to adjust their behavior accordingly. That is the part that I love. The ability to adjust your behavior accordingly. And if you look at it, it really encompasses transformational and relational. And it all composes into emotional intelligence. The ability to adjust their behavior accordingly. It's like if something is happening, how do you stop and pause and switch to ensure that whatever it is you're doing or about to do, it will not just be in the benefit of yourself, but the organization, the vision, the mission of the institution. Emotional intelligence really helps you to be thoughtful, to be mindful. It creates openness, it creates presence, which is required for listening. As a medical healthcare nurse leader, one of my biggest strengths is the ability to listen and to empathize. Sometimes I would see one of my nurses, and I remember there was an issue where I have a nurse, she is constantly doing the right thing, always on time, always have a great attitude, always great with her patients, very safe care and so forth. One day she came in and we were in the middle of huddles and she made a comment, had an outburst, and I realized that this was not her. But as a thought leader and as a human-centered leader, I was able to discern that this behavior is different. Let me get to the bottom of this. So what I did, I told her to go get some coffee and we'll talk after, because obviously something is going on. And I remember, after the meeting was over, I called her in my office. And the first thing I asked her, I said, how are you? I said, what is going on? And then she started crying and so forth. But if I didn't have that emotional intelligence to observe that something was going on with her, because this is not her, then I would not have been able to empathize and relate and give her some time off. So that is what, as leaders, we have to be able to do. I understand some leaders, all they want to do is to push the bottom line. You have to do this, you have to do that. But in the end of the day, you have people that are unhappy, you have unsafe practices, you have people that are burnt out, you lose people. When people are leaving, they don't leave organizations, they leave leaders. And as leaders, we need to understand that it is our duty to ensure that we are keeping and driving our team, not literally driving them out, but driving them to improve and be better and to get with the vision and the mission of the organization. One of the things an emotional intelligent person knows how to do is to really and truly be mindful. Mindfulness allows a person to let go of biases, preconceptions, judgments, and expectation. Yes, because when you are mindful, you will understand that people are different. And some of the things that we deal with on a daily basis has it transcends color, race, religion, social economic status. And as a human-centered leader, you have to be able to be all of that. Another thing that is very dear to me is self-awareness. So as an emotional, intelligent, human-centered leader, mindfulness is one of those things that are very important. And what is next is self-awareness. What is that? Self-awareness allows us to live in a place of integrity and authenticity. Becoming connected to experiences and relationships in order to understand how we are received and perceived. That is important. We have to make sure that we are self-aware to understand how we are received and perceived. You know, I am always asking for feedback because that is how I grow as a leader. And I always will say this actually whenever I'm talking to my kids. Um, Not because you think something is so, that means it is that. Not because you think that you are speaking in a certain tone and manner, that means that's how you are speaking. In order for you to get a full understanding as to how you are received, somebody else has to tell you. So a human-centered leader is aware that they have to be open to feedback. I used to say criticism, but I know it has a negative connotation. So I said feedback. They have to be open to feedback. They have to be open to how am I being perceived? How am I showing up? You know, my goal is to come and empower and inspire and make sure that you do what you're supposed to do. Am I delivering that way? Am I coming on there? Are you feeling welcome? Are you feeling accepted? Or am I coming there and my attitude is telling you that I don't even want to be here, so you shouldn't want to be here? What am I giving off? And as I am about to wrap this up, I really wanted to hone in on some things that is very important to me as a nurse leader, and the human-centered leadership. And I have worked in leadership in different facilities. I've worked in different organizations. I've worked in different specialties. So I am definitely that transformational leader with lots of leadership in different aspects. And one of the things that helped me to be able to acquiesce to any of those organizations is the ability to be flexible, the ability to be emotionally intelligent, the ability to be transformational, and the ability to be relational. So I was able to work in different organizations, including, like I mentioned, I was the director of nursing for one of the largest women facilities, prisons here in Atlanta, Georgia. And that was one of my best experiences because I thought I had to be a certain way in order to lead. So when I got there, oh boy, it actually helped me to be the leader that I am today. Emotional hygiene has been a topic that I actually came up with that. Um, Not the emotional part, hygiene, because I look at how we are so diligent in ensuring that we have our daily baths, brush our teeth, make sure that we are fully presentable. And we do that daily to ensure that we are making sure that our hygiene is where it needs to be. And I realized that emotionally, we don't do that. As a matter of fact, studies have shown that that's one of the last things that we do. We will take care of every other thing and everyone else, but we don't take the time to take care of our emotional space. And I had to talk about emotional hygiene, and I tied it into the human-centered leader because it's also part of that. It's part of the new phenomenon of not just healing, but being relational, but helping each other, being people-oriented, being others-oriented. Those are some of the things, and I think emotional hygiene aligns well with that. Emotional hygiene means that you have to be aware of your mental health and taking care of your emotional wounds when you get there, when you get them, because we do get them. We all get them. We all have emotional wounds. It's like any wound that is not taken care of spreads and becomes infected. By the time it becomes infected, we have to get antibiotics. Some infection leads to amputation. Some infection leads to death. So emotional hygiene is the beginning space of where we take that time to analyze, assess, and eventually make decisions to protect our emotional health. The importance of emotional hygiene, it improves your mental health. You know, when you are in feeling good and you're in a healthy space and you're not stressed out, you're getting rest, you're eating the right foods, you're doing what is necessary, your mental health is happy for that. It enhances your physical health. When you are feeling well emotionally and you're taking care of yourself, you are doing your exercises every day, you're watching what you eat, and your physical health is happy for that. It promotes positive relationships. Moment of transparency for me. I have found when I started my journey of leadership and healing and being the best leader, the thought leader, the human-centered leader, building relationship, my relationships improve significantly with my husband, with my children, with the nurses that I am over, with the students that I have, with my girlfriends. My relationships improve significantly. Productivity is increased. Imagine you come into work, you're feeling good, you're looking good, you're healthy, and then you go in and you're taking the best care of your patients. You have done something great because your patients are feeling better. So it increased productivity. It fosters and improves self-esteem. Yeah, the better you feel, the better you do. You're looking into, I want to feel good. Let me do all that is necessary to feel good. But the better you feel, the better you do. And it encourages personal growth. I can attest to that. Personal growth. You cannot have personal growth without emotional growth, because part of personal growth requires you to be emotionally healthy, requires you to know what is working and what isn't, requires you to understand where you are, what do you need in order to give you what you need for you to go where you need to go. So emotional hygiene is very, very important. And this is one of those that transcends race, gender, socioeconomic status, color. It is very important. Some common emotional challenges that will require you to want to make sure that you are taking care of yourself. It is stress. Stress is one of the number one killers. If we are not handling it well, stress can lead to our demise. Anxiety. We have over 85% of people that are walking around anxious, especially post-COVID. That has increased tremendously, where people are just anxious. They're anxious about different things. And if you're not taking care of your emotional health, that definitely can contribute to that. Depression. Depression is one of those things that is rising every day. We have people that are committing suicide because they're depressed. We have people that are not able to be their best selves because they're depressed. And then we have loneliness because we are not emotionally healthy. We cannot hold a relationship. We cannot keep a job. Our family don't want to be bothered with us, and we are lonely, which leads to lots of challenges. So all of these things are important for our emotional hygiene. How do we take care of ourselves? And I like that because I am on that journey, taking care of myself. What does that look like? What does emotional hygiene looks like? Firstly, we must practice self-compassion. Self-compassion, give ourselves grace. If we made a mistake, we're not going to sit there and just beat up on ourselves. And no, self-compassion for ourselves. Practice self-awareness. Like I said, that is a big thing. The ability to be aware of oneself, one angst, what is bothering someone, what is a trigger, that helps you to navigate what is it you want to do, how you want to do it, what do you need to do it, who are your resources. Setting healthy boundaries, that is very important as well. How do we set healthy boundaries? What does that look like? Like for me, if I see someone is calling me that I know they're not going to bring anything positive to my space, I don't answer that call. I let it go to the voicemail and I'll listen to the message because I'm aware that whenever I speak with them, I haven't mastered the art of not letting whatever they say take me in a different direction. So what I do, I don't engage. Boundaries is protecting yourself, protecting your space, your emotions, your heart. Because if we don't set boundaries, then anyone and everyone can just do and say whatever it is they want to. That can affect us. Regular physical activity, we want to make sure that we have that. You know, get up, get your walks in, whatever you do, you dance, you do whatever you do. Make sure to get adequate sleep. That's important as well. Get some sleep. Make sure you're getting your sleep. Limit exposure to negative influences. I love this. It goes back to the phone call, putting my phone on do not disturb. As a matter of fact, when I am home with my family, we make it a habit of putting our cell phones in a different space so that we can engage with each other. We can have conversations. We can be present, not talking and being on the phone and being on social media and trying to do all of that. That doesn't allow for being present, enjoying the moment. Practice gratitude. That is something that I do every day, ritually. I practice gratitude and I pray. For those of you who are spiritual, for me, I pray every day and I practice gratitude every day because every day I can find something to be grateful and thankful for. Even just having my coffee. Because when I am out there in the hospitals and when I am going to the different units and when I am seeing so many people that are waking up in the hospital, that are in surgery, that are doing so many different things. And I have the ability to open my eyes and say, good morning, and see my husband and my children. I am grateful. And sometimes when we remember those little things to be grateful for, it helps with perspective and it shifts our emotional space. And lastly, developing coping strategies. What does that look like? What do you need to help you feel better? Do you need therapy? That is something that you can figure out what you need. There's resources out there for you to get what you need. A lot of institutions are offering employee health or where you can get therapy or someone to speak to. A lot of organizations are offering that. But whatever you do to make sure to take care of you, that's important. And as I conclude and I wrap up this last slide, I'm talking human-centered leader, transformational, relational, emotional hygiene, and all of these things. And this last slide, it talks about what are some of the things, or what resonates with you. And here it says self. And around self is everything else. There's relationships, there's values, there's human compassion, there's humanity, there's excellence, there's transformative, there's connectedness, there's all of these things. But in the middle of that, what's important is self. How do we take care of ourselves? Because the best way to take care of ourselves is to do what is best for us. And when we are good, we are able to shine light on others. We are able to help others reach their potential. We are able to grow organizations. We are able to be the best and give of ourselves. And then when our cups are filled, we not only can give from a cup that is full, but we can give from the saucer where all the cup has overflown into, and we can give from that, but we cannot give from an empty cup. And that was my last slide. I am grateful for this opportunity. I thank each of you for taking the time and listening to this human-centered leadership and emotional hygiene. The goal was to help to understand that we can be our best selves and we can be our worst enemy. We just have to make sure that we are taking care of ourselves. You know, and before I go, there was one of Maya Angelou's quote that resonates with me. And one of those things is that people may forget what you do, people may forget what you say, but they will never forget how you make them feel. Thank you, thank you, thank you.